The skin is probably the most challenging aspect in rhinoplasty. So when I see a patient, I want to know what sort of skin they have. In other words, they have very thick skin or thin skin. And if they have thick skin, and that's the challenge really, what causes skin thickness? And the key point really is whether the skin is oily or whether it's just thick because of other factors. If it's oily skin, I tend to use tretinoin, that's vitamin A creams on them. These are not vitamin A creams that you can buy just without the prescription. These are prescription medications, in other words, they're higher strength. And sometimes you also need to go on what we call as Roaccutane, which is a tablet that they take. And it takes a good 3 to 4 months preparation. So treating their oiliness is key in getting the right outcome, if you like, after rhinoplasty.
During rhinoplasty surgery, we will not perform anything and we will not do anything on the skin. We will detach the skin from underlying bone and cartilage, and we will change the shape of the bone and cartilage. And then the skin must redrap to the new skeletal framework. So the quality of the skin is very important. We have some issues for both thick skin and thin skin patients. You know, in the thick skin patients, because there is thickness of the skin, you cannot see excellent results after surgery because the skin is thick and there is not good attachment of the skin and underlying bony and cartilaginous framework. And on the other hand, in a very thin skin after surgery, because the skin is very thin, you can see just if there is 1 millimeter irregularity in the cartilage, it can show after surgery. So as a general, the quality of the skin is very important. I tell to all of my patients also that expectations must be realistic, and we cannot achieve excellent result in the thick skin patient. When the skin is thick and the underlying cartilage is thin, there is not good result. But when the quality of the skin is good and the cartilage have good strength, the results will be much better. So honestly, we cannot change significantly the quality of the skin before or after surgery. We can change a little the quality of the skin, but we must prepare mentally the patients that they must accept the quality of the skin from one patient to another patient is different. So the results from one patient to another patient absolutely will be different also.
If we focus clinically what we can do to the skin, I liaise with a dermatologist, but certainly when I have a thick skin patient, an oily skin patient, a skin that suffers from a certain pathology like rosacea, which is more common than what we think, I give instructions to the patient to start a treatment of preparing the skin, of cleaning the skin, of using either local or treatment by mouth to diminish the thickness of the skin, which will work to our advantage for the end result. Of course, when I refer to rosacea, when we are talking about more specific dermatological diagnosis, I do ask a dermatologist to see the patient in the meantime, because if there's a certain type of treatment, I prefer to have the specialist seeing them and confirming that and treating them appropriately. But all this works to their advantage, and I must admit that patients are surprised when I talk and explain all these things because they're not aware that this plays such an important role.